This is Dr. Charles Denham. Our rapid response team with the MedTech Bystander Rescue Care Program is producing a series of videos, webinars, and presentations to deal with the coronavirus crisis. The coronavirus crisis has intensified the patient safety communication risks. Dr. Christopher Peabody is an assistant clinical professor of emergency medicine at the University of California in San Francisco. He's been a contributor to our patient safety work since he was a medical student when we met at Harvard when he was a Zuckerman Fellow. He contributed to the development of our 5 Rights of Emergency Care framework designed to help reduce patient safety incidents, which is addressed in a 10-minute video available on our website. It emphasizes the role you can play to get safe care and great care. It addresses the right provider, assuring the right diagnosis, getting the right treatment, and going through the right discharge process, and making sure that you get the right follow-up. He provides his perspective of the impact of the coronavirus crisis on these 5 rights. Thank you, Toph, for taking time for us today in this during this crisis. I know it's really challenging for emergency medicine doctors, especially those that are teaching as you are. Can you just walk us through your perspective of the 5 rights of emergency care as they pertain to these new changes with the coronavirus crisis?
I think that in the times of the coronavirus, there are many different parts of the emergency departments that's changed for patients and for their family members. And I think there's no other time that's been more important that you know the 5 rights, and especially certain aspects of them. So, we're not allowing visitors now, Chuck, into the emergency department. And most hospitals are shutting down visitors for the entire hospital. So for certain patients especially, this has a lot of ramifications. One is that if you bring in your elderly family member to the emergency department, we're not able to interact now with the son or daughter or the other loved one that brings them in and is usually in charge of their medical care. So we have to do all of this interaction over the phone. And so knowing these specific types of the 5 rights, when we give you a phone call and we have limited time in the emergency department to find out about your loved one is really critical. And so the previous diagnoses and the previous surgeries that your loved one has had is something to have on hand. The medications they've been taking and how they've been taking them is also really, really important. And then the reason why they came to the emergency department in the first place and the symptoms they've had is also helpful in getting the right diagnosis.
So, Toph, what about the right treatment now that you've got a patient there without their family and you have to go through shared decision-making and whether they're admitted to hospital or not, and a lot of the factors that we would normally do with the family?
This gets really tricky, Chuck, and it's something that we're doing more and more so over the phone with family members. Especially with coronavirus and the COVID-19, is that, a lot of times patients need to self-isolate and they need to have a room in their house and a non-shared bathroom for them to safely go home. And so we'll be asking those questions over the phone and kind of gauging whether or not that it's safe for the patient to go home for other family members in the household.
And now I know that you have been really wonderful about helping teach us about return precautions. Would be prior to the coronavirus crisis, when I asked you, what is the biggest risk in patient safety? You identified one of them being return precautions. Can you frame what those are and then why that's important and then why it's important for coronavirus?
Absolutely. So return precautions in the emergency department are probably one of the most important parts of your discharge and having a safe discharge home. Emergency physicians see you for a limited amount of time and only one point in time. And as we know, a lot of things in medicine can change. And so really understanding why to come back to the emergency department is critically important for any visit to the ER, but especially in coronavirus. This is one of those viruses that as I see more and more patients with it, is really different than any other type of virus I've taken care of. Influenza, usually the regular flu, Chuck, is the symptoms are really most severe right when you get the illness. And we know what that curve kind of looks like. With coronavirus, I'm seeing patients come back after they've started to feel better, day 7 to day 12. And so really understanding the return precautions for coronavirus, knowing that even though you're starting to feel better, you may have this second wave of where you're starting to get a worsening cough, worsening shortness of breath when you're walking, and the fever can come back as well. These are the things that I'd like patients to know when they're diagnosed with coronavirus and go home.
Well, Todd, thank you so much for sharing this with us and also for giving us a demonstration of what to expect when we see you. I think that's particularly helpful. So thank you very much.
Oh, it's my pleasure. And it's one of those things that talking about patient safety and what to expect, especially in these times of unexpected coronavirus illness, is something that I'd like to get across to patients.
The care of our communities is absolutely critical. Thank you for all you're doing to protect those at risk and those who are most vulnerable. As we say to all of our MedTech bystander rescue care teams, we have to fight the good fight, finish the race, and keep the faith. Everyone is a patient and everyone can be a caregiver.